Hello, everybody. Today I want to bring to your attention an article that was recently published in the Journal of the American Medical Association. The title of this article is Association Between Marijuana Exposure and Pulmonary Function Over 20 Years. So this is the largest study to date to look at the correlation between smoking cannabis and decreased pulmonary function. So what I want to do is I want to take you through the more poignant points of the article and discuss some of the figures with you so you have a better understanding of the primary literature. So first, the authors give us a little bit of background. Exposure to tobacco smoke causes lung damage with clinical consequences that include respiratory symptoms, chronic obstructive pulmonary disease, and lung cancer. Chronic obstructive pulmonary disease and lung cancer are leading causes of death, and smoking tobacco cigarettes is the most important preventable cause of death in the United States. Marijuana smoke contains many of the same constituents as tobacco smoke, but it is unclear whether smoking marijuana causes pulmonary damage similar to that caused by tobacco. So, previous studies have already established that tobacco decreases pulmonary function. But what the authors are trying to figure out here is whether marijuana smoking causes the same effects as tobacco. So here's what they did. They collected repeated measures of tobacco and marijuana smoking, as well as pulmonary function, over the course of 20 years in more than 5,000 study participants. The participants underwent a baseline examination and 6 follow-up examinations with 69% retention at year 20. Pulmonary function testing was performed at 0, 2, 5, 10, and 20 years. So what did they measure in this study? Well, they measured two things. First, they measured the forced expiratory volume in the first second of expiration, also known as the FEV, and secondly, they measured the forced vital capacity, also known as the FVC. These are two standard measurements routinely measured to assess pulmonary function. So now let's look at the results. They divided their participants into 4 groups. One group was non-smokers. The second group was tobacco-only smokers. The third group was marijuana-only smokers. And the fourth group was both tobacco and marijuana smokers. So now let's look at the bottom line and the results. So what did they find? Well, the authors state that in fully adjusted models that considered 4-level categorizations of current and lifetime exposure to tobacco and marijuana, tobacco smoking, both current and lifetime, was associated with a lower FEV and current smoking with a lower FVC. How does that compare to cannabis? Well, in contrast, exposure to marijuana, both current and lifetime, was associated with higher FVC and lifetime exposure with higher FEV. Now let's look at figure 2. This is a series of 4 graphs that summarizes the data in a concise form that is visually understandable. So first I want to bring your attention to the top 2 graphs. Okay, these two are for pulmonary function by current smoking behavior. The black line is for tobacco. The blue line is for cannabis. On the graphs, the x-axis is the number of episodes per month, or cigarettes per day, from 0 to 80. And on the y-axis is the change in FEV in milliliters. Okay, the horizontal black line represents 0 or baseline. So let's follow the lines. The black line starts at 0, but then it slopes down, and it continues to slope down at a constant rate after about 15 to 16 cigarettes per day. In contrast, let's look at the blue line, which is cannabis. It has the opposite effect. It goes up to a height of about 25, maybe 20, and then it goes back down to baseline here, and then it continues to decline slightly after that. Now, let's look at FVC. Similar situation here. You have tobacco in the black line here, it decreases, but cannabis increases, reaches a plateau, and then it slightly decreases. Now these two are for current smoking behavior. Now let's look at lifetime smoking behavior. For FEV, you have a steep decline for tobacco users. Okay, in this case, the x-axis is joint years or pack years from 0 to 100. And as you can see, at heavy doses of tobacco, for lifetime smokers, you have a very, very large decrease in pulmonary function for FEV readings. Whereas cannabis actually increases, comes down to baseline at about 30 to 35 joint years, and then it slightly decreases. For FVC, we have a similar pattern. Tobacco decreases substantially, but look at this. FVC for lifetime smokers of cannabis actually increases as the number of joint years increases. Now, what can we take from these four graphs? Well, the biggest thing that I see is that cannabis smoking in both current and lifetime smokers at a lower number of episodes or lower number of joint years, we actually see an increase in pulmonary function. But at higher number of episodes or joint years, we see a slightly decreased pulmonary function. What does this mean? Well, this means that FEV is negatively affected by very heavy smokers of cannabis, but FVC is not affected by heavy smokers of cannabis. In fact, FVC increases in both current and lifetime exposure. The biggest thing that we can take from these graphs is that there is a big gap between cannabis and tobacco, and we can finally see conclusive evidence that cannabis is nowhere near as harmful to lung function than tobacco. And now for the author's conclusions. Our findings suggest that occasional use of marijuana for these or other purposes may not be associated with adverse consequences on pulmonary function. It is more difficult to estimate the potential effects of regular heavy use because this pattern of use is relatively rare in our study sample. However, our findings do suggest an accelerated decline in pulmonary function with heavy use and a resulting need for caution and moderation when marijuana use is considered. And that's the article. In my opinion, this is a very well done study, and hopefully it'll put to rest some of the concerns you may have about the consequences of smoking cannabis as it pertains to lung health. In my opinion, we should all be educated about what we are doing with our bodies, and I tend to take a risk-benefit approach to everything I do, including the use of cannabis. For me, the benefits of smoking cannabis greatly outweigh any of the side effects that may have negative impacts on my health. I hope you all learned something useful today, and thank you for watching.